Well, welcome to another edition of our Cafecito Conversations. And I'm being joined today by Marissa Brash. And Marissa, thank you so much for joining us today. And we have our coffee mugs. We're in our little virtual coffee house. And Marissa, just thank you so much for your support over the years, especially since you participated in the Diversity Ambassador Program last year. So how's it been as a Diversity Ambassador, and how have you been applying even some of the things that we discussed in our Diversity Ambassador Program? So how's your journey as a Diversity Ambassador so far?
Well, thank you so much for having me. I'm excited to talk a little bit about my experiences. The Diversity Ambassador training was such an exciting opportunity for me because I think I had had a very narrow view as to what diversity really is, especially as it relates to my own kind of personal context. And part of the training helped me to take the time to be self reflective, to recognize my own diversity, and to also be a lot more aware and sensitive to other forms of diversity and the people that I interact with. And as a public health professional, that means that I'm constantly dealing with members of the public who come from such diverse backgrounds. And part of the training really helped me to be aware of this continuum of different types of diversity experiences so that I could be a lot more sensitive to the people that I'm working with and to understand a lot of the different types of backgrounds and experiences people have and how they really shape their perceptions and really enabling me to be a stronger healthcare practitioner as well as a better mentor to my students who are also going to be going out and working with the public.
Oh, that's wonderful. So you feel that the diversity ambassadors gave you some tools to see your healthcare profession through new eyes?
Exactly. I think it enabled me to recognize a variety of experiences that I might not have attributed to diversity in the context that I did if I hadn't been exposed to the conversations and the training that we had as part of this diversity ambassador training.
Beautiful. So, Marissa, we're working on a mutual project right now, the Healthcare Professionals Cohort. And you were really central in approaching us that this would be a very good project for us to begin to explore. And now it is starting spring 2021. So as you think about this, yay, and now we're having a cafecito talking about it. So as we're thinking about the healthcare professionals that you work with, um, what might you tell them, just fresh, going into diversity ambassadors, what to expect and how that will actually translate into looking at their world through new eyes, but also maybe some specific tools that you've used since you were in the program?
I think that what I would say really spoke to me was the way that the diversity ambassador training was set up so that there would be a concept that would be introduced. And sometimes I would hear it and think, well, I don't know how that applies to me, or maybe that's not part of my context or my experience. And then we would have some kind of facilitator who would come in and provide some kind of context of their own experience. And that would be also interwoven with some of the diversity mosaic experience videos. And as soon as I started to hear those, I would immediately start generating thoughts, either of myself, my own experiences, or experiences that I have had in the healthcare setting, working with people and kind of thinking about their own background, their own experiences, the conversations I've had with them, And that really enabled me to start kind of having this big, um, kind of like epiphany type moment, like a light bulb going off. And then after that, we'd break out into small groups and have the conversation where we'd have, 2 to 4 people having a dialogue kind of about um, our own expectation about, where we understood the context from these topics. And I felt like when I was able to do that, that helped me to really begin to not only once again have the self-reflection of my own experiences, but to hear another person's experiences and to go back and forth and to be able to kind of probe a little further and to dig deeper and understand a little bit about where they were coming from. That really helped me to understand diversity on a much greater scale, and understand the different nuances of diversity and inclusion, and then to really start to recognize it, so that as I was kind of going out into the workplace after that, my mind was kind of opened and primed to start to recognize these experiences more and more for what they were in my life, and start to recognize my own diversity, start to have conversations. I felt like it also helped me to be more assertive, so that when I was around other people who made comments or said things that I didn't see contributing to the version of diversity or inclusion that I really wanted to model in my life, I had a lot more authority, I felt like, to speak up. And in the past, I think I may have minimized those experiences because I said, I'm not, I would minimize my own diversity and say, well, I'm not a very diverse person. Therefore, I don't have a right to say anything. I don't have a right to put anyone in their place. Or maybe their own feelings are so valid that I don't have a right to say anything. But I think as a result of the conversations that I had, I realized that my place as an ambassador is really to speak up for people when they're not there to speak up for themselves, or when they're not able to speak up for themselves. And so as a result, I felt like that diversity ambassador training gave me the assertiveness that I needed in my life to be able to speak up for some of the vulnerable populations or other communities that I work with, where those people weren't present or able to speak up for themselves when I saw words or deeds being done that didn't match with what my own conviction portrayed.
Wow. Marissa, that's so powerful. Thank you for hitting on those important points. You mentioned in the Diversity Ambassador Program that the word that comes to mind right now, Marissa, is voice. So what was powerful in your experience is that you heard other voices, and that was powerful, and you're talking to different people in the cohort and our facilitators. But then hearing those voices gave you that assertiveness to have your own voice.
Exactly. And I think it even did more than that, because I feel like as a faculty member, as a preceptor, my voice is also used to inspire other voices. And so that in it was a kind of like a double gift, in that it not only helped me find my own voice, but it helped me to use my voice to hopefully inspire other students. One of the classes that I ended up teaching at the last minute in the spring semester, I had a faculty member who was supposed to teach, but when the pandemic happened, she got called into work double time in the Orange County Healthcare Agency, so like the Department of Public Health there. She wasn't able to teach, and so I stepped in to teach the class at the last minute, and it was cultural inclusivity in healthcare. And I think I would have been completely overwhelmed and unprepared for how to teach that class, thinking, well, I'm not the right person to teach it because I'm not diverse. I don't have any special background. I don't think I'm the right person to speak up. But I feel like by being in this training, I was able to recognize such interesting forms of diversity that I was able to use my voice to say, I didn't see this about myself. Now, let me help encourage my students to have a similar type of dialogue, so that they could actually have their own experiences where they found their own voices as well. And that was a really meaningful experience to me, because I was able to use my voice to help my students find their voice. And now I'm hoping that as they go into public health, they'll help other people find their voices as well. And this will continue on and continue on. And so that was something that I felt was a very meaningful and you know, fortuitous timing for me to be in that position to feel much more confident about helping students to identify their own forms of diversity and to work on inclusivity from a different context.
Oh, beautiful, Marissa. It's a fantastic illustration of paying it forward, is that the gifts that were given in our sessions by others, speaking their voice, and then listening to other voices, empowering your own voice, and then you gave that same gift to your students, who will then, in turn, be able to understand others and provide that voice uh, to their patients and to their communities. So we thank you, Marissa, for all you've done for APU Big Picture, and specifically for our Center for Diversity, Equity, and Inclusion. And we're proud that you're a diversity ambassador. Thanks, Marissa, for our cafecito time today. And may this not be the end of our conversations. Blessings to you.
Thank you. I really do appreciate the opportunity to be part of this because I see the value and I'm excited in these next steps that, the healthcare health professional cohort, because I feel like in healthcare, you are constantly working with diverse members of the population, and you never know someone's story. Just because you see someone, you don't actually see them, and that's a really important thing to remember. And it's easy to forget sometimes. I think it's easy to minimize, and right now more than ever, we need to be united. We need to be each other's advocates and allies. And so I feel like I am excited that this is such a good time, in public health and in healthcare, to kind of bring us together and to identify the ways that we can be more inclusive.
Yes.
And I appreciate that this is, the right time to be taking these steps forward.
Thank you, Marissa, for being on this journey with us. And it is indeed the right time. Thank you for your time today in our virtual coffee house. And you're a blessing to us and to APU and to all the communities you serve. Thank you.